Nursing 345, the interview. This first slide lists the objectives. They are to understand the use of diagnostic reasoning and clinical judgment, discuss the importance of high-level assessment skills, describe expected physical, psychosocial, cognitive, and behavioral milestones of a patient on the basis of developmental stage, assess the basic characteristics of culture and the steps to cultural competence, define the meaning of common nonverbal modes of communication, and lastly, assess the behaviors that are considered in an assessment of a person's mental status. The interview includes subjective data collection. This is the patient's perception of health, and it's the first step in the therapeutic relationship. The interview goal is to identify health strengths and problems as a bridge to physical examination. It's the first and most important part of data collection. This is where you collect subjective data, that is, what a person says about his or her perceived health state. An individual knows everything about his or her own health state, and the nurse knows nothing. Successful interview characteristics include gather complete and accurate data about a person's health state, including a description of any symptoms of illness. Establish rapport and trust so the person feels accepted and free to share all relevant data. Teach the person about health states so that he or she may participate in identifying problems. Build a rapport to continue therapeutic relationship and to facilitate future diagnoses, planning, and treatment. Begin teaching for health promotion and disease prevention. The interview contract. This consists of spoken and unspoken rules for behavior. It is what a person needs and expects from healthcare and what the health professional has to offer. It's a mutual goal and is optimal. The mutual goal is optimal health for the patient. Contract terms include time and place of interview and physical exam, introduction of and explanation of the healthcare provider's role, purpose of the interview, how long it will take, expectation of participation for each person, presence of others, which would mean family, confidentiality and to what extent it may be limited, any cost the patient must pay. The process of communication, there's 4 different processes of communication. The first is sending, then there's receiving, there's internal factors, and there's external factors. The process of communication, sending, is a behavior which is conscious and unconscious, verbal and nonverbal. All behavior has meaning. That includes body language such as posture, gestures, facial expression, eye contact, foot tapping, touch, and even where you place your chair. Process of communicating, receiving. This is awareness of messages you send is only part of the process. Words and gestures must be interpreted in a specific context to have meaning. The receiver attaches meaning determined by his or her past experiences, culture, self-concept, and current physical and emotional state. Successful communication requires mutual understanding by the sender and receiver. Patients' health problems intensify communication because patients depend on you to get better. Communication can be learned and polished when you are a beginning practitioner. Communication is a tool, as basic to quality healthcare as tools of inspection or palpation. The third one, process of communication, is internal factors. Awareness of internal and external factors and their influence allows you to maximize communication skills. The internal factors include liking others, empathy, and your ability to listen. External factors include ensuring privacy, refuse interruptions, the physical environment itself, dress. You should note that note-taking may be unavoidable. However, that is because you cannot rely completely on memory for details of previous illnesses or review of body systems. It breaks eye contact too often, however. It shifts attention away from the person, diminishing his or her sense of importance, interrupts patient's narrative flow. It impedes observation of patient's nonverbal behavior, and it may be threatening to the patient's discussion of sensitive issues. Some often use tape recording or video recording. Again, this may interfere with the communication process. There are different techniques of communication. You have the working phase, which is to gather data. Verbal skills include questions to patient and your responses to what is said. There are two types of questions. You have open-ended questions, which you should use them in the following situations. That's to begin the interview, to introduce a new section of questions, and whenever the patient introduces a new topic. Closed or direct questions ask for specific information. This type of questions elicits short 1 or 2 word answers, such as a yes or no answer or a forced choice. You can use the closed or direct questions in the following situations. After opening narrative to fill in details person may have left out. When you need more specific facts about past health problems or during review of systems, or lastly, to move the interview along. Responses. Assisting the narrative. Facilitation encourages the patients to say more and shows you are interested and will listen further. You may use silent attentiveness that gives the patient time to think and organize what to say without interruption from you. And it also gives you a chance to observe a person unobtrusively and note nonverbal cues. Reflection. You can use reflection to echo a patient's words. Repeating what a person has just said focuses further attention on a specific phrase and helps the person continue in his or her own way. There are types of verbal responses. Empathy is the first one, which recognizes a feeling and puts it into words. It names the feeling and allows expression of it. With empathy, the patient feels accepted and can deal with freely opening up the conversation. Clarification, you use when the person's words are ambiguous or confusing. It's used to summarize person's words and to simplify them to make them clearer. You are asking for agreement, and the person can then confirm or deny your understanding. Confrontation is a frame of reference that shifts from patient's perspective to yours. It may focus on discrepancy or inconsistency in person's narrative. You have observed a certain action, feeling, or statement, and now can focus a person's attention on it, and you can give honest feedback about what you see or feel. Interpretation is based on your inference or conclusions. It links events, makes associations, implies cause, ascribes feelings. It helps a person understand his or her own feelings in relation to the verbal message. If your inference is incorrect, the patient may correct it and thus prompt further discussion of topic. There's also explanation. These statements inform the person. You can share factual and objective information, offering reasons for requirements or actions. And then finally, the last type of verbal response is summary. It's a final review of what the person has said. It condenses facts and presents your view of the health problem. It is a type of validation that person can agree with or correct. Both you and the patient should participate. It usually occurs at the end of the interview, and it signals that termination of the interview is near. There are 10 traps of interviewing. They are providing false assurance or reassurance, giving unwanted advice, using authority, using avoidance language, engaging in distancing, using professional jargon, using leading or biased questions, talking too much, interrupting, and using why questions. Elements of the interview process include nonverbal skills, physical appearance, posture, gestures, facial expression, eye contact, voice, touch, closing the interview. You also have to consider developmental considerations when you are communicating with different ages across the life cycle. This includes infants, toddlers and preschoolers, school-age children, adolescents, adults, and of course older adults. There's also special needs considerations. This includes hearing impaired, acutely ill, under influence of street drugs or alcohol, those who must be asked personal questions, sexually aggressive, crying, angry and threatening violence, or anxious. Culture and genetics also play a part. Gender, you need to be aware of maintaining cultural norms during interview and examination process. You should maintain privacy and modesty. Sexual orientation is being neutral related to the patient's presentation by being mindful of communication patterns and being aware of your own personal bias and baggage. You also have to consider cross-cultural care. There may be a probability of miscommunication when two people are from different cultural backgrounds. Cultural backgrounds of both healthcare professional and the patient influence verbal and nonverbal communications. Cultural perspectives are on professional interactions, etiquette, and space and distance are other factors that may influence communication. Overcoming communication barriers. You need to work with and without interpreters. Nonverbal cross-cultural communication. You have to know what the norms are. Touching patients is a necessary component of a comprehensive assessment. However, physical contact with patients conveys various meanings cross-culturally. So you have to be aware of that. Patients' significant others may exert pressures on nurses by enforcing culturally meaningful norms in the healthcare setting, which we will be talking about cultural in another PowerPoint. Nonverbal behaviors. There are 5 types of nonverbal behaviors which convey information about a person. They are vocal cues. Vocal cues include pitch, tone, and quality of voice, including moaning, crying, and groaning. You also have action cues, which include posture, facial expression, and gestures. Object cues, which include clothing, jewelry, and hairstyles. Personal space is interpersonal transactions and care of belongings. And touch, which involves use of personal space and action. Health literacy. This is more than just the ability to read, but rather includes understanding and following directions that lead to effective communication between the patient and the healthcare provider. A patient may be literate but not have health literacy. It involves the use of quantitative measurement and memory aspects. There are certain tools for determining literacy. The first one is test of functional health literacy. The second one is rapid estimate of adult literacy in medicine. And then there's also the last one is called the newest vital sign. The newest vital sign is very easy to use. I'm familiar with that tool, and it's you would actually have the person look at an ice cream label, and it's included in the tool, and then be able to determine if they will be able to understand the instructions that you provide. There are certain techniques to improve health literacy, and that is oral teaching, use of written materials based on standard educational levels, and teach back or use the return demonstration when you are teaching.